Okay guys, before going to start maternity care and delivery, so we will have recap related to yesterday's session. Okay, so what is hysterectomy guys, and how do you code hysterectomy procedures? Yeah, go ahead. What are the keywords you need to code or you need to check while coding hysterectomy procedures?
The approach, it is laparoscopic or laparotomy, that kind.
Okay,
And complete whether it is or partial hysterectomy they have done, and size of the
size of the uterus basically.
yeah.
Okay, so no worries. So whenever you want to code hysterectomy, first we need to check approach. So whatever it is the procedure, first we need to check for approach. Okay, so after you know that, for example, it is a laparoscopic hysterectomy, so you need to check for uterus weight. What is the uterus weight? Okay, then you need to check for, along with hysterectomy, if the patient is performing removal of tubes and removal of ovaries or not. Okay, then what are the keywords for myomectomy? So here also same, myomectomy also we have open procedure and laparoscopic procedure. Okay, so here also you need to check number of myomas. So this numbering system is applicable for only for intramural myomas. For surface myomas, we no need to worry about the numbering system. Okay, so these are very important questions you need to remember while going for same day surgery interviews. So now we will start maternity care and delivery, which is one of the most complicated chapter in same day surgery coding. Okay, so what is maternity care and delivery? Basically taking care about the or taking care of pregnant patient before delivery and after delivery or during delivery. So all these are included in maternity care and delivery. So usually we will call it as antepartum. So if the patient takes patient care before the delivery, we will call it as antepartum. Okay. During the delivery also, patient will take care about the patient. So after the delivery, we will call it as postpartum. Okay, so this postpartum includes 6 weeks following the delivery. So whenever you go to interview, they will ask you the differentiation between antepartum, delivery and postpartum. Okay, so you need to remember these definitions. Antepartum is before delivery. During the delivery, patient will take the patient's care, and after the delivery also, patient will take the patient's care. Usually we will call it as postpartum. So postpartum is 6 weeks following the delivery. Okay, so these things you need to remember. So next, these maternity care and delivery codes we need to use if the patient is uncomplicated patient, means patient does not have any problems during the pregnancy and during the delivery. Okay, so that you need to remember. So you need to use these maternity care and delivery codes if the patient is uncomplicated. So patient does not have any problems basically, and patient came in for delivery. So that time only we need to use these codes. As we have discussed, antepartum includes initial prenatal history, physical examination, and subsequent prenatal history, as well as physical examinations, recording of weight, blood pressure, fetal heart tones, routine chemical urine analysis, and monthly visits up to 28 weeks gestation. Okay, so monthly visits up to 28 weeks gestation comes under antepartum. Bi-weekly visits up to 36 weeks gestation. Okay, and weekly visits until delivery. Okay, so These are the included in antepartum care. So what is antepartum? Before delivery or after delivery?
Before delivery.
Yeah, perfect. Okay, so here 28 weeks gestation means patient needs to antepartum includes 28 weeks gestation means patient needs to come into the or need to visit the physician monthly once. Okay, so that they are telling here. So 28 weeks gestation means how many trimesters? You know trimester?
Second trimester.
Yeah, 2 trimesters. Okay, so first trimester is 0 to 14 weeks. Second trimester is what, guys? What is second trimester?
14 to 28.
Yeah, 20 weeks. Perfect. And what about third trimester?
28 to until delivery.
Yeah, perfect. So what they are telling here? So 20 weeks gestation means how many trimesters?
2 trimesters. Second one.
So total how many months? 2 months, na? So 2 months or 4 months? 28 divided by 4. How much? 7. Okay, 7 months. Correct or not, guys? So monthly visits. Only one visit per month until 28 weeks gestation. So bi-weekly means from 28 to 36 weeks gestation, bi-weekly. Okay. So bi-weekly means monthly twice and weekly visits until delivery. So these all are included in antepartum care. Okay. And delivery service include admission to the hospital, admission history and physical examination, management of uncomplicated labor. So these codes, as we have discussed previously, these codes you need to use if the patient does not have any problems only. Okay. And vaginal delivery or cesarean delivery. Okay. Next, for surgical complications of pregnancy, see service in the surgery section. Okay. If the patient is pregnant and if the patient is having any type of problems, so we need to code from surgery section. Like for example, if you take appendectomy, 40,000 series, hernia 40,000 series, ovarian cyst, which series, guys? Ovarian cyst and Bartholin cyst. Which series you will use for ovarian cyst and Bartholin cyst? We have already learned, correct? So 50,000 series or 5 series for these two. Okay. Next, we will see the codes. Antepartum and fetal invasive services. Okay. 59000 amniocentesis diagnostic. 59001 amniocentesis therapeutic amniotic fluid reduction. Okay. So what is amniocentesis? Anyone knows? What is synthesis? So
Fluid collection.
yeah, fluid collection. Then what is amnio? So amniocentesis means aspiration or removal of fluid, amniotic fluid from the uterus or pregnant patient. Okay. So most of the time physician will perform to check any type of fetal disorders, and here physician will remove the excess amniotic fluid using amniocentesis diagnostic. As it is a diagnostic procedure, physician needs to check the fetal disorders. Okay. 59001 amniocentesis therapeutic amniotic fluid reduction includes ultrasound guidance. Okay. So 59001 is therapeutic procedure. Okay. For example, if the patient is having or mother is or pregnant patient is having more fluid or more amniotic fluid, usually we will call it as polyhydramnios. Okay, poly means many, hydrominous means fluid in the uterus. So if the patient is having polyhydramnios, therapeutically physician will remove that fluid or amniotic fluid. So here you don't need to code ultrasound guidance separately. Ultrasound guidance is already included in 59001. So this is the 59001. So here, what is your diagnosis here? 59001. What is your diagnosis, guys? Just now we discussed, correct? Lavanya, what is the diagnosis? Here, your diagnosis will be polyhydramnios. Okay, polyhydramnios means excessive amniotic fluid. So using 59001, patient will remove that amniotic fluid. So this is the amniotic fluid. This is the ultrasound device. Okay, this is the needle and drainage system. So using this needle, patient will remove the excessive amniotic fluid. So if you go to interview, they may ask you, what is polyhydramnios? What do you tell, guys?
Excessive fluid in the amniotic.
Excessive fluid in the pregnant uterus. See here, two babies are there inside the uterus. Okay, so this is the amniocentesis therapeutic. Okay, so just you need to remember here, physician will perform this procedure for polyhydramnios. Okay, so that you need to remember. Next we have 59020, fetal contraction test. Okay, so what happens if the patient wants to know how fetus will act during the uterine contractions? So that time patient will perform 59020. Okay, so during the contraction of the uterus, how fetus acting, what is the heart rate of fetus, and how the fetus oxygenation occurs during the uterine contraction. So that is the 59020. Next is 59025, fetal non-stress test. Okay, in the operative report you will see it as NST. Okay, so here also basically physician will examine the fetal heartbeat and oxygenation. Okay, most of the time physician will perform this non-stress test for postpartum or post-term or high risk pregnant patients. Okay, so 59020 is fetal contraction stress test. So physician will examine how does the fetus act during the uterine contraction. 59025, this is non-stress test. Physician will not apply any stress on the uterus. So that is the difference between 20 and 25. Okay. Next we have 59030, fetal scalp blood sampling. Okay. So here physician will take the blood sample from the scalp of the fetus through the dilated cervix. Okay, so that is the procedure here. So physician will take blood from the fetal scalp. Okay, so most of the time physician will perform this procedure for fetal hypoxia. Okay, so here fetus is unable to have good oxygenation. So in order to identify what is the problem with fetus oxygenation, physician will perform this fetal hypoxia or fetal scalp blood sampling. So you know, correct? In the body, how does the gas exchange occurs? Anyone? How the gas exchange occurs? So through the blood only. Okay. For repeat fetal scalp blood sampling, use 59030 and C modifiers 76 and 77. Okay. So that is the thing you need to remember. So for example, if the physician performs repeat fetal scalp blood sampling on the same day, so you need to use 59030 and you need to append 76 modifier and 77 modifier. So what are 76 and 77 guys?
76
Same
repeated procedure by
completed by
same
same
provider.
physician or different physician?
Perfect. Yeah. 76 is same physician, correct? 77 is different physician. So if the patient performs twice this procedure same day, you need to use these modifiers based on the physician, whether same physician or different physician. Next, 59050. Fetal monitoring during labor by consulting physician with a written report, supervision interpretation, 59051 interpretation only. Okay. So what happens sometimes if the patient is having more complications, if the single attending physician is unable to take care about the patient, this attending physician will take other physician help. Who is that person? Consulting physician. So here, in order to monitor this labor, we have two physicians. One is attending physician, one is consulting physician. Okay. For example, if the consulting physician performs fetal monitoring during labor, and also he will perform written report as well as supervision interpretation, you need to use 59050. Okay. If the consulting physician performs only interpretation of the report, he will not supervise, 59051. Okay. So that is the difference between 59050 and 59051. So here non-attending means consulting physician. So then who is attending physician here? Who is attending, guys? The surgeon is the attending physician. Who will perform the delivery is the attending physician. Okay. This consulting physician will perform the monitoring. He will not do anything. Monitoring, and he will write his report. And also he will supervise an interpretation, 59050, and if the consulting physician performs only interpretation, 59051. So you need to use these codes only for non-attending. For attending, you will not use 50 and 51. Okay. 59070, trans-abdominal amnioclusion, including ultrasound guidance. Okay. So here, this is opposite of this code. 59001 is for polyhydramnios, means excessive amniotic fluid. Okay. If the patient is having less amniotic fluid, so that time patient needs to introduce or infuse the amniotic fluid. So that time we need to use 59070. The most appropriate diagnosis for this transabdominal amniofusion is oligohydramnios. So poly means excessive amniotic fluid. Oligo means less amniotic fluid. So that is the difference between 59001 and 59070. Okay, so if you go to interview, they may ask you what is the difference between polygohydramnios and oligohydramnios. So what is the difference, guys?
Poly excessive amniotic.
Perfect. Yeah. Poly means excessive amniotic fluid. Okay. So that is the thing you need to remember. Okay. Next we have 59072, fetal umbilical cord occlusion, including ultrasound guidance. Okay. Here patient will perform occlusion of the fetal umbilical cord. So in the operative report, you will see it as UCO. Okay. So if the patient is having any type of high risk twin pregnancies, okay, so patient will perform this one. Here, just patient will stop blood flow to the umbilical cord. Okay, if the patient is high risk pregnancy, patient will perform this procedure. In the operative report, you will see it as UCO, umbilical cord occlusion by What is the use of this code, guys? 59072. What happens during this procedure? So here physician is stopping blood flow to the fetus. Okay, so that is the purpose of this one. 59072. 59074. Fetal fluid drainage, including ultrasound guidance. So 59072 also, you don't need to code ultrasound guidance separately. In 59074 also, you don't need to code ultrasound guidance separately. Okay. So fetal fluid drainage. So here physician will perform drainage of the fetal fluid. Okay. So what is vesicocentesis? So here vesico means bladder, centesis means removal. So removal of urine from the bladder to examine the urine for any type of fetal abnormality. Thoracocentesis. So what is thoracocentesis, guys? We already learned, guys, correct?
Fluid from the thorax area.
Yeah, perfect. So if the patient removes fluid from the thorax area, we will call it as thoracentesis. Then what is paracentesis?
From abdominal area.
Perfect. Yeah. So basically, wherever you say centesis in the operative report, you need to code based on. So what is your keyword?
Location.
Perfect. So based on location, you need to decide what type of centesis is. Okay. Sometimes what happens in the live coding, so they will not provide like these keywords like vesicocentesis, thoracentesis and paracentesis like that. So that time you need to check where physician is performing this procedure, whether it is in the bladder, whether it is on the thorax or whether it is in the abdomen. So based on those keywords, you need to code appropriate CPT. Okay. 59076. Fetal shunt placement including ultrasound guidance. Okay. So here also the purpose of this fetal shunt is to remove the fluid only. Okay, this is aspiration technique. Okay, so this is here physician will place the shunt and he will remove the fluid. So these procedures are related to fetus, not related to mother. Okay, so these are the codes related. Okay, next we have excision. Okay, so excision here. Okay, so these are very important. Next, 59100 hysterectomy abdominal for hydatidform mole or abortion. Okay, so anyone knows hydatidform mole? So no worries. So basically, hydatidform mole is a tumor. Okay, so in order to remove the tumor, physician will perform this hysterectomy. Okay, so here physician will perform incision on the lower portion of the uterus. Okay, and he will remove the tumor. So here what is your diagnosis for 59100? What is your diagnosis and what is your keyword?
Hydatidform mole.
Mole, yeah, correct. Or abortion. Okay. Next, along with this hydatidform mole excision, the patient performs tubal ligation. We need to use 58611 in conjunction with 59100. Okay. 59120. Surgical treatment of ectopic pregnancy, tubal or ovarian, requiring salpingectomy and oophorectomy, abdominal or vaginal approach. So what is ectopic pregnancy?
Pregnancy in the fallopian tube.
Yeah, perfect. Yeah, so basically here ectopic pregnancy means normal course of pregnancy is in the uterus. So if the patient is having pregnancy outside the uterus, anywhere, it is called as ectopic pregnancy. So pregnancy outside the uterus is called as ectopic pregnancy. So we will use 59120 for if the patient is having pregnancy in the tubal, or tubal means your fallopian tube or ovary. Okay. Here physician will perform removal of the tubes as well as removal of the ovaries, abdominal or vaginal approach. So based on the approach you need to code this one. Okay. Next 59121. So surgical treatment of ectopic pregnancy, tubular ovarian without salpingectomy and or oophorectomy. Okay. 120 is including salpingectomy and oophorectomy. 59121 tubular ovarian without salpingectomy and or oophorectomy. Okay. So 59130 is abdominal pregnancy. 59136 interstitial uterine pregnancy with partial resection of uterus. Okay. 59140 cervical with evacuation. Okay. For example, in the operative report you will see, so while performing the examination I saw pregnancy in the cervical area. So which code you will use? So I have performed. So which code you will use, guys?
59140.
Yeah, perfect.
5140.
Yeah, perfect. So ectopic pregnancy in the cervical area. Okay. So here physician will see that patient is having so pregnancy in the cervical area, and if he performs evacuation, so directly you need to code 59140. Okay. For example, physician will tell that, so I observed the patient, so she is having uterine pregnancy. So interstitial means in the muscles of the uterus. Okay, so I have performed the resection of the uterus. Which code you will use? Here pregnancy is not in the
59136.
yeah 59136. So here pregnancy is not in the uterus. So interstitial means uterine walls. So that time physician will perform excision of a partial excision of the uterus. 59136. Okay. So what is your diagnosis here? All these codes?
Ectopic pregnancy.
Yeah. So basically we have ectopic pregnancy. So we have tubular like abdominal like we have separate codes in the diagnosis. So based on ICD-10 you need to code these procedures. Okay. Just always you need to match your diagnosis with your procedure. Okay. So for example, if you want to code abdominal pregnancy, so your diagnosis must be abdominal pregnancy, then your CPT must be 59130. So you need to correlate diagnosis with procedure. Okay. Next 59150. Laparoscopic treatment of ectopic pregnancy without salpingectomy and or oophorectomy. 59151 with salpingectomy and or oophorectomy. So what is the difference between this code? 59120 and 59150. What is the difference? Anyone? See the code description. You need to see the code description. Yeah, perfect. Go ahead.
Without self-injectomy and or oophorectomy, this one is 515 is with the self-injectomy or oophorectomy.
So most important keyword here is approach. See, these are our open approach. Correct or not?
Okay.
Yes, yes.
Yeah. Can you see
Yes,
any
yes.
laparoscope here or endoscope? No, na?
No.
So as already we have discussed, you don't find any keywords like endoscope, scope or laparoscope. You need to consider them as excision or open approach. So in this code description, they have clearly mentioned laparoscopic treatment, means laparoscopic approach. Okay. So here in 59150, salpingectomy and oophorectomy mandatory or not, guys? If you want to code 59150,
No.
yeah, perfect. So for example, if it is mandatory, how do you code?
59151.
Yeah, perfect. So just you need to check the approach. Whenever you will code ectopic pregnancy, you need to check the approach, whether it is open or laparoscopic. Okay, so this is the laparoscopic treatment of ectopic pregnancy. Okay, symbiosis pubis, uterine cannula, uterus. This is the uterus. This is the laparoscope needle or trocar. Usually we will call it as trocars. Okay. So ectopic pregnancy removed. So here patient is a pregnancy in which part of the uterus, which part of the genital system, guys? What is this? What type of pregnancy it is?
Is it a fallopian tube?
Perfect. So usually we will call it as tubal pregnancy. Okay. So operator report they will not mention fallopian tube pregnancy. So just they will mention tubal pregnancy. So here patient is having tubal pregnancy. See here, this is uterine tube, this is ovary, uterus, needle for opening tube. So this is for tubal pregnancy. This is also ectopic only but tubal pregnancy. Okay. Next 59160, Caritas postpartum. Okay. So sometimes what happens, after the delivery, few patient will have little bit of placenta or retained placenta. Okay. So because of that retained placenta, patient may have bleeding or hemorrhage. Okay. So that time we need to use 59160, Caritas postpartum. So 59160. So how do you code if it is not obstetrical? This is for obstetrical postpartum. Okay. So how do we code if it is not postpartum? So you need to code from other series like 50,000 series which we have discussed, like D and C correct, dilation and correctors, all those codes you need to use if the patient is not pregnant or if the patient is not in the postpartum period. So you need to use this one 59160 if the patient is under postpartum only, and you need to append 78 modifier for unplanned return to the OR if it is in the postpartum period. So what is postpartum?
After delivery.
So how many weeks? Six weeks following the delivery. Yeah, 6 weeks following the delivery is called as postpartum. So within 6 weeks only you can code this one 59160. So after 6 weeks you need to code female genital system procedure, not from the maternity care and delivery. Got it guys? Difference? Clear? Any doubt here? Clear na?
Yes.
Okay. Introduction then. 59200. Insertion of cervical dilator, laminaria, prostaglandin. Okay. So sometimes what happens? So due to muscle contractions, all those condition, patient is unable to like dilate the cervix or open the cervix. So that time physician will use the cervical dilator. Usually in the operative report we will see it as laminaria or prostaglandin. So basically laminaria is a one device. Okay. And physician may use therapeutic or medicated cervical dilation also using prostaglandin. Okay, prostaglandins are a group of drugs. So laminaria is mechanical dilation, prostaglandin is medical dilation of the cervix. So that time we will use 59200. Okay. Next we have repair 59300. Episiotomy or vaginal repair by other than attending. Okay. So what is episiotomy?
Make incision in the salping.
Yeah. So basically vagina only here. Yeah. 59300 episiotomy or vaginal repair by other than attending. Okay. So basically if the patient having the delivery during the encounter episiotomy or vaginal delivery, we will not code separately. Okay. So if the patient exclusively came in for episiotomy or vaginal repair, we will use 59300. Okay. So what is the difference here? During the delivery, we can't code vaginal delivery or vaginal repair. But if the patient came in not during the delivery, so separately, exclusively came in for vaginal repair, we will use 59300. Okay. And during the delivery also, other than attending performs a vaginal repair, we need to code separately. Okay. For example, here, physician A is the attending physician. So he is performing the delivery, and physician B is the another physician. He is not attending, but he is performing the vaginal repair. So how many codes we will use? So that time we will use delivery code as well as this vaginal repair code. Why we will code vaginal repair? Why means this vaginal repair will be performed by other than attending. Okay, so that is the thing we need to remember here. Got it, guys? Here 59300. When to use and how to use.
Yes.
Any doubts? Clear, na? Okay. Next 59320. Circlage of cervix during pregnancy, vaginal, abdominal. Okay. So basically, if the patient cervix is very weak, okay, in order to keep the cervix closed, physician will perform the stitches. Otherwise, we will call it a circlage. Okay, that time you will use 59320. If it is vaginal approach, 59320. If it is abdominal approach, 59325. So this code you will sometimes you will encounter during the live coding. Circlage of cervix during pregnancy, vaginal and abdominal. Okay. So what is circlage, guys? What is your diagnosis here? Circlage.
Expanded cervix.
Yeah.
Or during, I mean.
Yeah. So basically, physician wants to close the cervix. Means due to weakness in the muscle in the pelvic floor area, patient cervix is opened or dilated. So in order to reduce this dilation, physician will perform the circlage procedure. So if the cervix is dilated, it may possible for the patient to have premature birth, correct or not, or miscarriage. So in order to prevent premature birth or miscarriage, physician will perform the circlage procedure. So whenever you want to code circlage, you need to check the approach, whether it is vaginal or abdominal. 59350, hysterotherapy of ruptured uterus. Okay. So if the physician performs repair of the uterus, so what is your diagnosis here? What is your diagnosis, guys? Ruptured uterus. So in other place also we have seen this ruptured. Where did we see? Anyone remember or not? In digestive system. So ruptured appendix. So we have separate codes for appendectomy procedure. Okay, hysterotherapy of ruptured uterus. If the patient's uterus is ruptured, physician will perform this one. Hysterotherapy means suturing of the uterus. Okay. Next. So these are not related to delivery. Okay. So these are basically antepartum. You can think like that. Okay. Then we have vaginal delivery, antepartum and postpartum care. Okay. Here we need to remember few things before going to start this one. Okay. So here global OB codes we need to remember. So if you go to interview, they may ask you what is global delivery or global delivery codes. So global delivery codes includes antepartum, delivery and postpartum. Okay. So this section pertains to vaginal delivery, antepartum and postpartum care. And try to remember these codes we need to use uncomplicated patients encounter only. Means patient does not have any problems. For normal delivery, patient came into the hospital and patient has performed the delivery. So here in this section of codes, patient will perform antepartum care, vaginal delivery as well as postpartum care. So usually we will call them, if the same patient performs all these three sections, we will call it as routine obstetric care. Okay. Next 59400 routine obstetric care including antepartum care, vaginal delivery and postpartum care. So these three must be provided by same physician, not different physicians. Okay. So that is the key thing you need to remember. If you want to code 59400, same physician needs to perform antepartum care, vaginal delivery as well as postpartum. That time we will use 59400. Okay. So this is the vaginal delivery. Okay. So try to remember, normal presentation of the fetus during the delivery is cephalic presentation. So this is the cephalic. Okay. So always in normal pregnancy or normal delivery, head needs to be come first. Okay. So that is the cephalic presentation or vertex presentation. Next 59409 vaginal delivery only. Okay. So what is the full code description here? Here patient will perform only vaginal delivery. He will not perform antepartum and postpartum. 59409. Okay. So usually we will call them as less than OB codes. Okay. Less than global OB care codes. So this is complete global OB care code. This is less than global OB care code. Okay. Next 59410 vaginal delivery only including postpartum care. If the patient performs both vaginal delivery as well as postpartum, we will code 59410. Okay. Next we have external cephalic version with or without tocolysis. Okay. So that time we will use these codes. Okay. So external cephalic version. So what is external cephalic version?
With the help of anesthesia, if the baby is in the breech position, then
Perfect.
external cephalic.
Yeah, correct. Okay. So here during the external cephalic version, patient will apply manual pressure. So as we have discussed previously, normal fetus presentation is in the form of head down position. So this is normal delivery. If the fetus head is on the top and legs are on the bottom, so that time patient will perform this external cephalic version. So usually if the legs are on the bottom side, we will call it as breech presentation. Okay, so if you go to interview, they may ask you, what is breech presentation? So what is breech presentation, guys? What is breech
Head is on
presentation?
the top and legs are in the bottom. If the baby have that means head is in the top and is in the bottom, then it is a breech presentation and
Yeah.
it is a medical emergency.
Yeah, perfect. Okay, and also here tocolysis. Okay, so basically tocolysis is the stopping of preterm labor. Okay, or premature uterine contractions. So that tocolysis is not mandatory basically here. If the patient performs external cephalic version, we need to use 59412. Most of the time you will, on the ambulatory surgery coding, you will get this one, 59412. Okay. Next, see here, they are telling that if the patient performs both delivery as well as external cephalic version, so we need to code this 59412 separately along with delivery. Okay. Next we have 59414 delivery of placenta, separate procedure. Okay. If the physician removes the placenta after the delivery, so that time you will use 59414. Okay. For antepartum care only, we need to use 59425, 59426 or appropriate E&M codes. Okay. For antepartum care visits, 1, 2, 3 antepartum care visits, we need to use E&M codes. Okay. 59425, antepartum care only, 4 to 6 visits. 59425, 59426, 7 or more visits. Okay. So if you go to interview, they will ask you, so if the patient performs only 3 antepartum visits, how do you code that scenario? So how do you code, guys?
With ENM.
Yeah, perfect.
ENM.
Yeah, correct. Just you need to remember, if the patient performs 3 antepartum visits, you need to code E&M. So you will not code 59,000 series. If the patient performs 4 to 6 antepartum visits, 59425. If the patient performs 7 or more visits, 59426. Okay. 59430, postpartum care only. Okay. If the patient performs postpartum care. So previously we have seen this is complete antepartum, delivery and postpartum. This is routine OB care code or full OB care code. Okay. If the patient performs vaginal delivery and including postpartum, this one 59410. Okay. If the patient performs only postpartum care, he will not perform antepartum as well as delivery. So that time we need to use 59430. Okay. So here these codes all are related to vaginal delivery only. So your patient will perform antepartum, vaginal delivery and postpartum care. Okay. Next same set of codes we have for cesarean delivery. Okay. So if you go to interview, they may ask you, what is VBAC? Okay, see here, patients who have had a previous cesarean delivery and now presents with expectation of a vaginal delivery are coded using 59610 to 59622. If the patient has a successful vaginal delivery after a previous cesarean delivery, use codes 59610 to 59614. Okay. Usually we will call it as VBAC. V means vaginal, B means birth, vaginal birth after cesarean delivery. Okay. Here, when to use these codes? If the patient is having first pregnancy using the cesarean delivery. Okay. Now patient came in for vaginal delivery. So if the patient delivers vaginal delivery after first cesarean delivery only, we need to use 59610 to 59614. So here patient is having like initial cesarean delivery and patient has attempted to perform vaginal delivery. Okay. If the physician is unable to perform vaginal delivery, we need to use 59618 to 59622. Okay. So if the physician performs elective cesarean delivery, we need to use 59510, 514 and 15. Got it, guys here? What is VBAC? What is VBAC?
Vaginal delivery after cesarean.
Don't remember like that. Vaginal birth, VBAC. Otherwise, you will get confused again during the interview. Okay, VBAC, vaginal birth after cesarean delivery. Okay, so what is important here? Whenever you want to code VBAC procedure, you need to check whether VBAC is successful or not. Why means, if it is successful, we have separate set of codes. If it is unsuccessful, we have different set of codes. VBAC is simple. First cesarean delivery and second time patient wants to have vaginal delivery. If the vaginal delivery is successful, we have separate set of codes. In the second time vaginal delivery is unsuccessful, we have separate set of codes. That's all. Okay. Next, these codes are related to cesarean delivery. So previously we have seen antepartum, vaginal delivery as well as postpartum. So these are cesarean delivery. 59510 routine obstetric care including antepartum care, cesarean delivery and postpartum care. Okay. So here if the same physician performs antepartum, cesarean delivery as well postpartum, 59510 routine OB care. Okay. If the physician perform only a cesarean delivery, he will not perform antepartum as well as postpartum, 59514. So this is reduced OB, 59514. Okay. So if the physician performs both cesarean delivery and including postpartum, 59515. So he will not perform antepartum care. He will perform only delivery or cesarean delivery as well as postpartum, 59515. Simple. Okay. So if the physician performs during the cesarean delivery, if the patient is interested to have removal of the uterus also, you need to code this add-on code 59525. Okay. So if you observe here, you need to use this code 59525 along with the cesarean delivery only. See 510, 514, 515 and 618, 620, 622 we will see soon. Okay. Next we have cesarean delivery. So this is the cesarean delivery. So here physician will perform one vertical incision. So this is the vertical incision. This is the transverse incision. And he will remove the fetus from the uterus. So this is the, so tell me, is this normal position or breech position?
Normal position.
Yeah, perfect. Normal position. Okay. So this is normal position. Next, delivery after previous cesarean delivery. What do you call delivery after previous cesarean delivery?
VBAC.
Yeah, VBAC. Okay, so here they have provided same guidelines, whatever they have mentioned here, same guidelines here. Okay, 59610 routine obstetric care including antepartum care, vaginal delivery and postpartum care after previous cesarean delivery. So first set of codes are for vaginal delivery. Okay, next set of codes are for cesarean delivery. These set of codes are for cesarean delivery, vaginal delivery after previous cesarean delivery. So VBAC 59610. So this is global OB code. So which includes antepartum care, vaginal delivery and this postpartum care. But what is important here, you need to use this series if the patient is having previous cesarean delivery only. So if the patient performs cesarean delivery, so how do you code? Which set of codes you will use? Only cesarean delivery.
59510.
Perfect. So if the documentation does not contain any information related to previous cesarean delivery, you need to use 59510 series. Okay. 59612 vaginal delivery only after previous cesarean delivery. So this is routine OB care or complete OB care. So okay. 59612. So after patient is having previous cesarean delivery, now in this visit patient has performed the vaginal delivery. So this is incomplete OB code or OB care 59612. Why means only here physician will perform vaginal delivery. 59614 vaginal delivery only including postpartum care. So here physician will perform vaginal delivery after previous cesarean delivery as well as postpartum 59614. Okay. So we will see one example here. So that is the thing you need to remember. 59618 routine obstetric care including antepartum care, cesarean delivery and postpartum care following attempted vaginal delivery after previous cesarean delivery. Okay. So this is second time cesarean delivery. So patient came in for cesarean delivery, anticipation of vaginal delivery. but if it is unsuccessful, so we have guideline, correct? See here, if the attempt is unsuccessful and another cesarean delivery is carried out, use codes 59618 to 59622. So this is the code. So here, whenever if the patient is having previous cesarean delivery and current it is not possible to perform vaginal delivery, so that time again physician will perform the cesarean delivery. So that time we need to use 59618. This is for routine or complete OB code. So here it includes antepartum care, again cesarean delivery as well as postpartum care. Okay. 59620, cesarean delivery only following attempted vaginal delivery after previous cesarean delivery. Okay. Next 59622 including postpartum care. Okay. So like that you need to understand these codes. So now we will see few example scenarios. Okay. So for example, so patient is having cesarean section last year. So this is her first baby. Now today she came in for second baby where patient has performed vaginal delivery. How do we code this procedure? So got the question? So 1 year back patient had, like, is it not 1 year back, 2 years back, like in 2023 patient had cesarean delivery. Okay. In 2025 patient has performed vaginal delivery. So here patient has performed all three, patient has performed complete OB care. Which code you will use? Anyone? Got the question? So in 2023, sorry guys. So in 2023 cesarean delivery. Okay. In 2025 patient has performed vaginal delivery. Okay. Which code you will use? Here patient has performed complete OB care. Which code you will use? Anyone? So how do you understand this scenario?
We have to
Which
read
set?
the code.
Which code? 59?
510.
Check 510. What is 510? Yeah. Who told 610? That is correct. Yeah. 59610. Why means this is VBAC basically. So vaginal delivery after previous cesarean delivery. Correct or not? So that's why here your code is 59610. Where is this? See this one? 59610. Vaginal delivery after previous cesarean delivery. Okay. Next scenario. Okay. So for example, first baby cesarean section. So first cesarean delivery as usual, this one only. So first baby cesarean delivery. Okay. And second baby again cesarean delivery. How do we call?
59618.
618.
Yeah, perfect. 59618. What is 59? So it is successful or unsuccessful?
Unsuccessful.
Yeah, perfect. Unsuccessful. Okay. Next, in another scenario, so patient came in for delivery. So single pregnancy. Here physician has performed complete OB care. Cesarean delivery. How do you call?
59510.
59510. Yeah, perfect. 59510. So complete this one. Okay. In third scenario, physician has performed 2 antepartum visits. How do we code?
E&M codes we have to give.
E&M.
Perfect. We need to code E&M codes. Okay. So like that, you need to check all this. Okay. So next, these are single pregnancy. Okay. These examples all are if the patient is having single pregnancy. Now we need to understand twin delivery codes. So how do we code twin delivery? So twin delivery means in the same session patient will perform two deliveries. So A as well as B. So fetus A and fetus B. Okay. So here, for example, all vaginal deliveries. How do we code? See your CPT book. All vaginal deliveries. Here global OB code. So see the CPT book. So how do you code all vaginal deliveries? Checking or not, guys?
59400.
Yeah. 59400 or 59409 or 59410 based on what based on?
Maternity care and delivery.
Yeah. Based on this one. What do you call?
Antepartum delivery or post.
Yeah, antepartum, whether it is full global OB or less than global OB. So based on that, you need to code this procedure 59410. So correct. This is vaginal delivery. So we have coded for one baby. So this is we need to code for second also. Correct. This is twin delivery or not? This is twin delivery. So physician is delivering two babies. So first delivery we have coded. Okay. So what about second baby? What do you code? So here you need to call less than OB, less than GOB or global OB code. So here you will not code global OB code again. Here you need to code only this one. So whether 59409 or 59410, any one code based on your documentation. 59409 or 59410 with XU modifier. So mentioning that you are coding for another baby. Got it, guys? So what is the key important thing here? In one session you can use only one global OB code. You can't use multiple global OB codes. So that is the guideline here. So this is related to if the physician performs all vaginal deliveries. So what if physician performs one vaginal delivery and one cesarean section? So for first baby physician will perform vaginal delivery and second baby physician will perform cesarean delivery. How do we code?
59400 and 514.
Yeah. So vaginal delivery as well as we need to use same codes. Whatever we have used in the all vaginal. So what do we code here for cesarean delivery? Second fetus.
59514.
Yeah, perfect. 59514 and R 15 with which modifier?
XU modifier.
XU modifier. So we'll see what is 59514 here. See 59514 is only for cesarean delivery. See here, only cesarean delivery. So why we are coding this one? So based on CPT guidelines, we need to use only one global OB code. We can't use multiple global OB codes per session. Okay. Next scenario, VBAC. So here physician has performed delivery of two babies. So VBAC procedure. Sorry. So how do we code VBAC? How do you code, guys? VBAC. See the code. VBAC codes.
59610,
Perfect. 59610.
59612, 614.
Yeah, perfect. 59610, 612 or
614.
614. So this is for first baby. So what about second baby? So as it is a global OB code, you need to, per session, we need to use one global OB code. You have coded this one. 610.
59612 only? 612 or 614?
Perfect. 59612 or 59614 along with XU modifier again. Okay, so this is VBAC completed. Next, how do you code if the patient performs all cesarean sections? How do you code, guys? All cesarean sections.
5970,
59510,
514,
514 and 515.
Okay. So what about second one?
59514 and or 59515.
So we will see. So basically here you will not code cesarean delivery. Why means if the physician performs one incision, so physician will remove both fetus, correct or not? He no need to perform one more incision separately. So here you will not code any code for all cesarean section. Okay, but instead of that you can append 22 modifier here. Got it, guys? So here physician will perform only one cesarean section, means he will perform only one incision and he will remove two babies. What is the need to code once again this cesarean delivery? Needed or not? Got it, guys? Tanya, you got this one?
Yes, sir. Because in
Yes.
one incision only two babies.
Yeah.
Yes.
Perfect. So that's why instead of that you can use 22 modifier. So what is 22 modifier?
Increase
Extended
procedural
service.
service.
Yeah, perfect. Increased procedural service. Okay. Next scenario. Unsuccessful VBAC. So how do you code?
59618, 59620, 622.
So 618, 620 and 622. So here also same guideline. We will see one time. So unsuccessful means indirectly they are telling again cesarean delivery. Correct or not? So here also
Yes.
we will not code any code. Here also we need to use 22 modifier. Got it, guys? So for example, physician will perform this procedure. So physician has attempted means not at all possible. So vaginal delivery is not possible. Okay. So here also physician will perform cesarean delivery and remove the baby. So using the same incision, physician will remove two babies. So why do we need to code again? Got here? Any doubt or any confusion? These two mostly. Got it, guys?
Yes.
Yes, sir.
Yeah. Okay. Great. So this is very complicated. So nowadays few companies are asking only OBGYN coder. So after this session you can apply for OBGYN coding also. Okay. So like that you need to code all these procedures. So whenever you want to code this maternity care and delivery, you have 3-4 keywords. First one is vaginal delivery. Second one is C-section. Next one is VBAC. What is the last one?
VBAC unsuccessful.
Perfect. Yeah, VBAC unsuccessful. Simple. Okay. So mostly if you observe here, if the patient performs C-sections for second baby, you need to code again. If the patient performs vaginal delivery, you need to code second again. So that is the important thing you need to remember. For C-section, you no need to code delivery of second baby. If you code first baby and if you append 22 modifier, that's enough. Okay, simple. Okay, abortion. Okay, so abortion. So what is abortion? What is abortion, guys? Simple. Abortion is termination of pregnancy.
Of pregnancy.
Yeah. Okay. For medical treatment of spontaneous complete abortion. Okay. So this other name for spontaneous abortion is miscarriage. You need to use 99202 99233. For surgical treatment of spontaneous abortion, 59812. Okay. So what is spontaneous abortion?
Is it in? It is not induced. It is spontaneous. Miscarriage. Miscarriage is the spontaneous abortion.
Yeah, perfect. So basically during the spontaneous abortion, so patient will have the abortion and she will expel the contents. Okay. So that is spontaneous abortion. Next you need to remember one more thing, missed abortion. What is missed abortion?
It is induced abortion.
No. Missed abortion is also
Okay. So.
one type of spontaneous abortion where no bleeding after the abortion. So in spontaneous abortion, after the abortion, so there is a hemorrhage. Okay, in missed abortion, patient can't identify whether abortion is happened or not. She will not get any hemorrhage. So that is the difference. Got it, guys? Spontaneous and missed abortion. Clear? Spontaneous means abortion with hemorrhage. Missed abortion means abortion without hemorrhage. So that is the difference. Okay. Next, 59812. Treatment of incomplete abortion, any trimester, completed surgically. Okay. Incomplete abortion, other name is spontaneous abortion. So here patient had the abortion, hemorrhage occurred, but so completely it is not evacuated. So that time we need to use this one. See here, that's why they have mentioned. For surgical treatment of spontaneous abortion, use 59812. Okay. 59820. Treatment of missed abortion, completed surgically, first trimester. 59820. Okay. 59821. Treatment of missed abortion, completed surgically, second trimester. Okay. So this one. 59821. So among these three code, what is your keyword? 812, 820 and 821. What is your keyword? So how do you decide which code you can use?
Based on missed abortion.
Perfect. So like type of abortion. Type of abortion. Whether it is spontaneous abortion or incomplete abortion or whether it is missed abortion. So you need to use 59820 and 821 only for missed abortions. You will not use for spontaneous abortion. So your diagnosis will be 820 for 821 missed abortion. Then only you can code 820 and 821. Okay. 59830. Treatment of septic abortion, completed surgically. Okay, if the patient is having abortion due to sepsis, 59830. Okay. 59840. Induced abortion by dilation and curettage. 59841. Induced abortion by dilation and evacuation. So induced means, what is induced, guys? Induced means intentional abortion. If the patient don't want pregnancy, these are the codes you need to use from 840, 59840. So if the patient documentation contains, so induced abortion by dilation and curettage. So here patient will dilate the uterus or dilate the cervix. He will go to uterus and he will remove the uterine contents using the curate. So that time you will code 59840. In 59841, induced abortion or intentional abortion. Okay. So most of the time this abortion will be performed for termination of pregnancy. Okay. For intentional, patient don't want pregnancy now. So that time physician will perform these procedures. So in 59841, physician will dilate the cervix and he will insert the suction machine into the uterus and he will evacuate the uterine contents. So that is 59841. 59850, induced abortion by one or more intra-amniotic injections, including hospital admission and visits, delivery of fetus and second dynes. Okay. So for induced abortion, if the physician performs intra-amniotic injections, like most of the time physician will perform methotrexate injections. Okay. 850 includes hospital admission and visits and delivery of fetus and second dynes. 59851 with dilation and curettage and evacuation. Okay. So after the injection of methotrexate, if the physician performs again dilation and curettage or evacuation, 59841. Okay. So if for induced abortion, physician has performed the amniocentesis or injections. Okay, but that is unsuccessful. So during that time, physician will perform hysterectomy and he will perform the abortion. So that time 59852. Okay. 59855, induced abortion by one or more vaginal suppositories, prostaglandins, without a cervical dilation. So here also same. Okay. So based on technique, you need to code all this procedure. Dilation and curettage evacuation with hysterectomy, failed medical evacuation. Okay. So this is for amniocentesis injection. So this is for prostaglandins vaginal suppositories. So based on the technique, you need to code these procedures. Anyway, you don't need to worry, just mostly you will get these codes only. 59812, 59841. Okay. So what is important while coding abortions, guys? What is important while coding abortions?
Type of abortion need to check.
Yes.
And
Trimester, first or second trimester.
Perfect. Next, you need to check technique, whether it is D&C or D&E. D&C means dilation and curettage. D&E means dilation and evacuation. Simple. Okay. Other procedures, 59866, multifocal pregnancy reductions, MPR. Means for example, sometimes what happens, patient has 2 babies or 3 babies or 4 babies inside the uterus. So that time, if the patient does not want 4 babies, so that time using the technique like medications, we will terminate the remaining pregnancies. Among 4, patient want only 1. Physician will terminate the remaining 3 pregnancies. So that time you will use 59866 MPR, multifetal pregnancy reduction. Okay. 59870, uterine evacuation and curettage for Hydatid farm mole. Okay. So if the physician performs uterine evacuation and curettage for Hydatid farm mole, 59870. Okay. Next we have removal of circular suture under anesthesia, 59871. So what is the circles, guys?
If it is a dilated cervix, then cervix is placed to close the to shrink the cervix for the time being, and later it is removed before the delivery.
So basically, this removal of circulate suture means, so basically patient will perform circulate suture for incompetent cervix. So in order to prevent premature delivery, so that time patient will perform the circulate procedure. Okay. So if the previously patient has performed the circulate insertion, now patient wants to remove that one. So that time we will code this one. Okay. So 59871. 59897. Unlisted fetal invasive procedure including ultrasound guidance when performed. So if the patient performs unlisted fetal invasive procedure, 59897. If you are unable to find any type of fetal procedure. So what is the difference between invasive and non-invasive? Anyone knows?
Percutaneous and all are non-invasive, and if there is incision made, that is invasive.
Perfect. 100% correct. Correct. Invasive means inside the incision, like creating the incision. Okay. Non-invasive means fish will not perform any incision. So using the imaging guidance, he will complete the procedure or surgery, non-invasive. Okay. 59898. Unlisted laparoscopy procedure, maternity care and delivery. So if you are unable to find any new technology or new technique during your coding, you need to use 59898. So you need to use this 59898 only for laparoscopic unlisted procedure. Why means we have separate open unlisted procedure also, 59899. Okay, so what is important here? Whenever you want to code unlisted procedure for maternity care and delivery, what is your keyword, guys? What do you need to check? So you need to check whether it is laparoscopic unlisted or open unlisted. Simple. Okay. Got it, guys? Any doubt? So if you are unable to find laparoscopic maternity care and delivery, 898. If the patient perform open procedure or open unlisted code, you need to use 59899. Okay. So any doubts in maternity? Now we will start endocrine system. Thyroid gland, incision 6000, incision drainage of thyroglossal duct cyst infected. Okay. Thyroglossal duct cyst. So this is the thyroglossal duct cyst. So this is the thyroglossal duct cyst. Fish will perform IND. This one. So what is your diagnosis here? Thyroglossal duct cyst. Okay. Next, excision. So these all are related to thyroid gland. Biopsy thyroid, percutaneous core needle. Okay. If the patient uses the imaging guidance, you need to use 70,000 series codes. So here patient will perform biopsy of the thyroid, percutaneous core needle. So what is your keyword if you want to code 60100? What is your keyword? What do you check in the operative report? So you need to check whether physician using the needle or not. Simple. If the physician uses needle for biopsy only, you will code 60100. Okay. 60200. Excision of cyst or adenoma of thyroid or transection of isthmus. Okay. If the physician performs excision of cyst or adenoma of a thyroid. So adenomas are benign tumors basically. So here you will see these adenomas in digestive system also, in the colon area most of the time. Okay. So that time you need to use 60200. If the patient documentation contains excision of adenoma of thyroid, 60200. Okay. 60210 partial thyroidectomy unilateral with or without isthmusectomy. So if the patient performs one side of the thyroid gland, so you need to check the anatomy first. See, this is the left lobe of thyroid, right lobe, isthmus. This is the isthmus, trachea, thyroid cartilage, cricoid cartilage. Okay. So if the patient performs unilateral, only one side, either left side or right side. So here isthmusectomy is not mandatory. So that time you will quote 60210. 60212 partial thyroid lobectomy unilateral with contralateral subtotal lobectomy. Okay, for example, if the patient performs right side lobe complete removal along with part of the left lobe, that time you will use this one 60212. So subtotal means half of the total. So here patient will not performing complete left side thyroid gland excision. He is performing only part of the lobe of the left lobe thyroid gland. So that time you will use 60212. 60220 total thyroid lobectomy unilateral with or without isthmusectomy. Okay. So here, so what is the difference between this 210 and 220 is, here patient will perform only part of the thyroid excision unilateral, not complete. So here patient will perform part of the thyroid, not complete thyroid lobectomy in 60210. That's why they have mentioned partial thyroid lobectomy. Okay. In 60220, patient will remove complete right side lobe. That time we will call this one 60220. Here again same 60225 total thyroid lobectomy unilateral with contralateral subtotal lobectomy including isthmusectomy. Okay. So that is the thing. So what is the difference between 610 and 620, guys? For example, in the documentation it contains, so patient will tell, so patient is have tumor on the right side of the thyroid gland. So I have performed the, or I have removed the part of the thyroid, right side thyroid. Which code you will use?
610.
Perfect. Yeah, perfect. You need to use 610, not 620. If you want to code 620, sorry, 220, patient needs to mention, so I have completed total unilateral thyroidectomy. Like that you need to understand. Because so this is the total thyroid lobectomy 60220. So patient will remove one side of the thyroid completely. Okay. 60240 thyroidectomy total or complete. So what do you understand this one? Thyroidectomy total or complete. What happens during this procedure?
They'll remove complete.
Yeah, perfect. So here patient will remove both right side and left side thyroid glands. Simple. That time we'll use 60240. Okay. 60252 thyroidectomy total or subtotal for malignancy with limited neck dissection. 60254 with radical neck dissection. Okay. So here if you want to code 60252 and 254, your diagnosis must be malignancy. Then only you can code 60252 and 60254. One important thing here is, for example, patient is having the malignancy or thyroid cancer. But if the patient will not perform limited neck dissection, you need to use these codes. Normal codes 220, 225 or 240. Even though if you are having the malignancy as your PDX, if the patient does not perform limited neck dissection. So what is neck dissection, guys? What is neck dissection? Anyone? So basically neck dissection means removal of the lymph nodes. Okay. For example, in the operative report if you see, so patient is having thyroid cancer. Okay. Patient mentions total thyroidectomy. Which code you will use, guys? 240 or 252? Anyone? So patient is having thyroid cancer. Patient has performed thyroidectomy. Total thyroidectomy.
240.
252.
Yeah. Here 240 is correct. Why means here I did not tell that physician has performed neck dissection also. Okay. In second scenario, for example, physician has performed subtotal thyroidectomy for malignancy and physician has removed the lymph nodes. Which code you will use?
252.
252. So that is the difference between 240 and 252. Even though your diagnosis is malignancy, you need to check the documentation whether physician is performing the lymph node removal or not. So based on that you need to code. Simple, correct? So this is limited neck dissection, means physician will remove only few lymph nodes. 60254 with radical neck dissection. Here physician will remove multiple lymph nodes. So that is the difference between 252 and 254. Okay. 60260 thyroidectomy, removal of all remaining thyroid tissue following previous removal of portion of thyroid. Okay. For example, patient has partial thyroidectomy in 2023. So now 2025, correct? So again patient came in for removal of remaining thyroid gland. So that time we will use 60260. Okay. 60270 thyroidectomy including substernal thyroid, sternal split or transthoracic approach, cervical approach. Okay. So here physician will perform thyroidectomy if the documentation contains sternal split or transthoracic cervical approach. You need to use 60270 and 271 based on the approach. Okay. 60280 excision of thyroglossal duct cyst or sinus. 60281 recurrent. So previously we have seen codes for IND, correct? So this one, where is this? See here. Incision and drainage of thyroglossal duct cyst infected. Okay. So this code is for excision, not for IND. Here also your diagnosis is same, thyroglossal duct cyst. So what is the keyword here, guys? What is the keyword?
Cyst.
Yeah. So here keyword is diagnosis thyroglossal duct cyst. For CPT your keyword must be, you need to check whether physician is performing IND or excision. So based on that you need to code. So for example, patient is having thyroglossal duct cyst excision in 2020. Again in 2025 physician has performed same procedure. How do you code?
281.
Perfect. 281. Yeah. So basically 60280 is 280 is for initial thyroglossal duct cyst excision. Okay. 60281 is for recurrent thyroglossal duct cyst excision. Simple. Okay. So in order to perform this thyroglossal duct cyst excision, if the patient uses the thyroid ultrasonography, we need to use 76536. 60281. Okay. Next, removal, aspiration and injection into thyroid cyst. 60300. Okay. If the patient uses the imaging guidance for this cyst aspiration or injection, you need to use imaging codes. These all the codes are related to thyroidectomy. Thyroid gland. Now we have parathyroid, thymus, adrenal glands, pancreas and carotid body. So we need to check the anatomy of parathyroid gland. Only you will get parathyroid gland in live coding. Okay, so these are the thyroid and parathyroid gland. Okay, so thyroid front side is thyroid gland. So back side of thyroid gland we have parathyroid gland. 1, 2, 3, 4. 4 parathyroid glands. Okay. Next excision 60500 parathyroidectomy or exploration of parathyroids. Okay, this one 60500 parathyroidectomy or exploration of parathyroid glands re-exploration. If the patient performs re-exploration of parathyroid gland 60502. If the physician perform parathyroidectomy with mediastinal exploration, sternal split or transthoracic approach, this one. Okay, mostly you will get this one only, 60500. So your diagnosis will be parathyroid adenoma. So for that physician will perform parathyroidectomy. You will use 60500. Regularly you will get this code only. Parathyroid adenoma excision, you will use 60500. 60512, parathyroid auto transplantation. Okay. So what happens sometimes during the thyroidectomy procedure, so in order to preserve the parathyroid gland, patient will place this parathyroid gland in another location of the patient's body. So that time you will use 60512. Okay. If the physician performs this parathyroid auto transplantation in the neck area only, why means thyroid gland is in the neck area, correct? You will not code this one. If the physician performs separate incision in order to perform parathyroid auto transplantation, you need to code 60512 separately. So that is the CPT guideline. Alright guys? Same incision for auto transplantation, you will not code 60512. If the physician performs separate incision for parathyroid auto transplantation, you need to code separately 60512. Simple. Okay. Next 60520, thymectomy. So we will see thymus gland. So thymus gland. See, primary site for production maturation of immune cell, particularly small lymphocytes that defend the body against foreign antigens. Okay, where do you see thymus gland? It is in here, in the thorax area. Here you have thymus gland in this area. So this is the thymus gland. Usually you will call it as below the thyroid. Okay.
Sir, just for one, I have one small doubt. Sir,
Yes.
what is the difference between thoracic area and mediastinal area?
So thorax means lungs area basically.
Mm-hmm. And
Lung area.
mediastinal area?
Mediastinal means sternal area, this area. So based on the approach. Okay. Here you don't have lungs, correct? Where are your lungs?
Lungs on the both sides, left and right side of the body.
Yeah. So mediastinum means, so we'll see once.
Okay.
Mediastinum and thoracic cavity. See this one. This is the thoracic cavity. This is the mediastinum. So this is the sternal area basically. Mediastinum. So this is the thoracic cavity, thorax area. Okay. So once we will see the meaning. So thoracic cavity is the chest area containing lungs and heart, and the mediastinum is central compartment within it. So mediastinum is the part of thoracic cavity basically.
Okay. So here only the heart and other
lungs.
Yeah. The mediastinum, heart and great vessels are is stored. I mean, it is placed.
Yeah.
Body.
Correct. So most of the time this mediastinum you will see during the heart procedure. Okay. If the physician wants to open the heart, he needs to perform mediastinal incision. Mediastinal incision. Use. What is the use of mediastinal incision? See, access to mediastinum, the chest area between the for diagnosis and treating conditional lung cancer stage, removing tumors, sampling lymph nodes and treating infection. And like if the physician wants to perform like heart procedures also, see here sternotomy. Okay, for that also physician will perform mediastinotomy. Okay, so you don't need to check, you don't need to worry, just you need to check the approach based on your course, whether physician is telling mediastinal and thoracic approach. Okay, so 60520, thymectomy partial or total, transcervical approach, separate procedure means Transcervical means which area, guys?
The via cervical area.
Neck.
Neck area. Yeah.
Yeah. Okay. 60521. Thymectomy, partial or total, sternal split or transthoracic approach. See here, they have mentioned both are them without radical mediastinal dissection. Okay. See the sternal split and transthoracic approach, both are same only. 60521. 60522. Sternal split or transthoracic approach with radical mediastinal dissection. This one 60552 522. Okay. If the patient performs thymectomy using the endoscopy or transthoracic thymectomy, video assisted thoracoscopic surgery 32673. Okay. Next we have adrenalectomy. Where do you see adrenal glands? On the kidneys. See, these are the adrenal glands. Okay. So if the patient performs adrenalectomy, partial or complete, or exploration of adrenal gland with or without biopsy, transabdominal, lumbar or dorsal, 60540. Okay. 60545 with excision of adjacent retroperitoneal tumor. If the patient performs adrenalectomy along with any tumor near to this area. Okay. So that time you will use 60545. 60600 excision of carotid body tumor without excision of carotid artery. Carotid body tumor. So is a rare, usually benign growth, also called paraganglioma. So these are the basically carotid artery. These are the carotid artery, correct? So in the artery you have the tumor. That's why they have mentioned it here. It is carotid artery tumor, carotid body tumor. Without excision of carotid artery 60600. With excision of carotid artery 60605. Simple. Okay, so this is the carotid artery. This is the tumor. Okay. Next, laparoscopy. If the patient performs laparoscopic adrenalectomy 60650. Okay. When unable to find any laparoscopic approach procedure in the endocrine system, you need to use 60659. Simple. Okay. So these are the more other procedures. 60660 ablation of one or more thyroid nodules, one lobe or the isthmus percutaneous including imaging and radio frequency. So previously we have seen thyroid excisions, correct? So here thyroid nodule ablation. So this is not for malignancy basically. These are for thyroid nodules. So thyroid nodules. So these are the thyroid nodules. So if the patient wants to perform ablation of these thyroid nodule, so you will code this one 60220, sorry 660. Okay. 60661 ablation of one or more thyroid nodules, additional lobe percutaneous including imaging guidance. If you are unable to find any open unlisted procedure in endocrine system 60699. So this is for laparoscopic unlisted procedure 60659. So this is for open unlisted procedure of endocrine system. So tell me if the patient performs right side lobe ablation and left side lobe ablation. How do we code?
60660.
Only one code or two codes?
Only one.
Total two lobes, correct. See here.
Okay.
60660 for right lobe, 60661 for additional lobe, means left lobe. Okay, simple. And here already this code description is having imaging guidance. So you don't need to code imaging guidance separately. That is the CPT guideline. Okay, so While searching the keywords, you can check based on the anatomical area, based on the procedure, based on the eponyms in the index. If you are comfortable, directly you can go to anatomical area also. For example, you are having the radial fracture. So directly you can go to radius section in the CPT book. Then you need to check each and every code. What is the exact procedure performed in the operative report. So like that also you can code. So based on your comfortability. So for example, if you don't know how to check in the CPT book, directly go to index. Check in the radius. For example, patient is having the fracture. You have two options. Okay. First main word is radius. And second option is fracture. Under fracture you can check for radius. So like that also you can check. Okay.